I'm sleeping in a container that is devoid of outside carcinogens that helps lift what you don't have, and it makes it, and it just, oh, come on, please.
Let's take a look throughout the years to really see what Sandra has done to stay youthful. In 1993, at the age of 29, you can see that Sandra has a nice widow's peak with a short forehead. She has good brow height and a great supratarsal platform and a really nice eye shape. As far as her nose, you can see that Sandra has a slightly boxy nasal tip. She has prominent nasal cartilages and thin skin. She also has a bit of a hanging columella. And when someone has thin skin, especially on their nose, you can really see the underlying structures. And that's why you're seeing the imprint of her nasal cartilages, especially the lower lateral cartilages, because the skin of the nose is thin. Now, some people ask me, well, how can you judge the thickness of the skin of the nose without being there in front of somebody? Oftentimes, I'm looking at exactly this, the imprint of the underlying structures, as well as the thickness of the ala, which are like the wings on the side of the nose. Sandra also has a flat upper lip shape. She has a scar that I noticed on the left lateral orbit. Right around here, there's a scar running diagonally. In 1994, at the age of 30, you can appreciate here that Sandra has strong masseter muscles. These are the muscles that live right here by the angle of the jaw, and they help us with eating, chewing, speaking, and there are certain ramifications of having larger masseter muscles. Sometimes people can complain of TMJ, which is temporomandibular joint dysfunction, where there could be some discomfort around the ear area because of the strength of the muscle. And also, cosmetically, it adds a bit of a boxiness to the lower face. Now, some people really like that aesthetically. Other people look to modify it, such as through Botox injection, that can slim the muscle and reshape the lower jaw area. Sandra also has a chin cleft right here in the center of her chin, and the cause of this is that as the two sides of the face develop in utero and the lower jaw begins to fuse, there sometimes is an incomplete fusion that leads to this little cleft right there in the center. In 1995, at the age of 31, you can appreciate that Sandra has a thin upper lip on smiling with overall good proportions at rest. Now, some of my patients who come in for lip lifts will ask for an improvement in their smile, and oftentimes they're referring to how much lip fullness is visible on smile. In Sandra's case, what we'll be tracking is this exact appearance of the lip on smile as we progress through the years to see if something has changed, like did she ever get lip filler, for example. Also, what I can see here is that Sandra has a nice strong jawline, and that overall helps with the appearance of the neck, especially as we age. In 1996, at the age of 32, I'm not seeing any changes. In 1997, at the age of 33, what I'm seeing is just that Sandra has a rectangular type of hairline, which is a normal variant of a female hairline. In 1998, at the age of 34, I can see a dorsal hump on the 3/4 view. So in addition to the lower part of the nose that we discussed with the cartilages, there's also a hump to the nose as well. And the hump of the nose is usually a combination of the cartilage on the top of the nose, on the bridge, as well as the bones. Usually where those come together, called the keystone area of the nose, is where you can see a dorsal hump develop. And when you go in surgically to sometimes remove these humps, you need to address both the cartilage and the bone to have a nice result. In 1999, at the age of 35, I'm not seeing any changes. Same in 2000 and 2001. 2002, also no obvious change. In 2003, at the age of 39, no obvious signs of Botox or filler yet. You can see when she smiles, the upper lip shape is similar to how it looked in 1995. She has this slight central tubercle prominence. She has no lumps or bumps from filler that I can see. Please make sure to subscribe to this channel. In 2004, at the age of 40, you can see full expression in the forehead with excellent eyebrow lift. And when the forehead has Botox placed into it, since it's the only true elevator of the eyebrows, what happens is the eyebrows tend to sink down and you're not able to lift the eyebrows as much as she's doing here. So I'm not seeing yet the introduction of any Botox. However, at the age of 41 in 2005, I am starting to see the use of Botox to the forehead and to the glabella areas, so that she has a much more smoothed out complexion from the use of neuromodulator, as far as I can tell. In 2006, at the age of 42, there are no further changes. In 2007, 2008, and 2009, also no obvious changes. In 2010, at the age of 46, what I'm starting to see is the introduction of filler specifically into the cheek area and the under eye area. Those are often treated together, and I am seeing some fullness in the under eye area, and the cheek does look fuller and bigger compared to what came before it. So I do see some changes when it comes to the use of filler. Usually the type of filler that's used for the cheeks is different from what's used for the under eye area. The under eye area is less forgiving and requires a lower G prime, also known as a lower viscosity type of filler, compared to what's typically used in the cheeks. In 2011, at the age of 47, I'm not seeing any obvious further changes. Same in 2012 and 2013. In 2014, at the age of 50, what I'm seeing here is that Sandra is aging quite gracefully. You are starting to see some minimal neck banding that's occurring, but she looks very age appropriate. And when I look at the tragus area, as you guys know I always do for any signs of facelift surgery, I'm really not seeing that with Sandra. It looks pretty much like her original tragal area. In 2015, at the age of 51, no further changes. Same in 2016, 2017, and 2018. In 2019, at the age of 55, what I'm seeing here is the introduction of some lip filler. Now, she may have started the use of lip filler before this, but this is, as far as I can tell, the first obvious signs, and the lip filler is most obvious when Sandra smiles. You can see that there's more fullness to the upper red lip when compared to prior, and that is most likely attributed to filler. In 2020, at the age of 56, I'm not seeing any further changes. In 2021, at the age of 57, you can see that the lip filler that I think she's had is now starting to settle out right by the vermilion border. So if you look at around the Cupid's bow area, you can see that there is this sort of bumpy prominence, and that is likely some filler migration. So it's important to remember that filler can migrate and it can stay in the face or other parts of the body for much longer than we originally thought. There have been these MRI studies that have proven that. So filler really can linger for a long time. Luckily, with hyaluronic acid-based filler, there is a solution for the most part, which is the use of Hylenex or hyaluronidase. And this is an enzyme that breaks down hyaluronic acid. You can use this to help improve a situation like Sandra's, where there is this settling of the filler. But it's important to keep in mind that there are other repercussions of the use of lip filler over time, and that includes internal scarring inside the delicate area of the red lip. Now, that can lead to a fuller look of the lip that won't really go away with the dissolving of HA. So something to keep in mind, along with, of course, other types of filler risk, including vascular compromise. So maybe Sandra has also used Sculptra, for example. This is a biocompatible synthetic substance that can stimulate collagen production, and that is something that a lot of people are starting to turn to help rejuvenate the face in a way that's less obvious than just putting a ton of filler in. Now, Sculptra is something that you need to use repeatedly over time, and it takes time to see the benefits, but it can lead to some youthfulness and improved rejuvenation of the face. Now, other non-surgical modalities that maybe Sandra has been employing could be the use of, say, radiofrequency energy. Radiofrequency is now the primary modality for non-surgical tightening of the skin. So this is a type of energy device. It has essentially replaced what used to be like Ulthera, which was an ultrasound-based energy source. Now there's these radiofrequency energy sources that help to tighten the skin and can give you sort of a non-surgical lift, if you will. You can see again with Sandra in this image that there is the continued use of cheek filler. In 2022, at the age of 58, I'm not seeing any further change. I think that coupled with great skincare and, of course, eating well and exercising, I think Sandra has really combined these non-surgical modalities, of course, with the use of Botox and filler, in my estimation as well, to create a very youthful appearance at her current age without the use of surgery. I am not seeing any obvious signs of facial plastic surgery for Sandra Bullock.